الرحيم. صباح الخير طلابنا الأعزاء. اليوم راح تكون المحاضرة الأولى لهذا العام حول محاضرات الباطنية لكلية طب الاسنان جامعة الوطنية. The first lecture today is the hypertension, and the hypertension is an abnormal sustained elevation in the arterial blood pressure. It leads to serious sequelae, including death if untreated. So it is important to follow the patient who is suffering from hypertension. Roughly speaking, normal systole 120, diastole 80, pre-hypertension 120 to 139, diastole 80 to 89. Stage 1 hypertension, systole from 140 to 159, while the diastole from 90 to 99. Stage 2 hypertension, more than 160 in the systole and more than 100 in the diastole. Now, what are the etiology for the hypertension? In general, we can classify it into two types of causes, either essential or secondaries. Essential, also called the primary, which is about 90 to 95 of all causes, including the underlying mechanism is unknown. This is the first. Second, maybe familial، يعني نشوف انه بالعائلة اكو عندنا اكثر من شخص عنده hypertension, or interaction between environmental and genetic factors, maybe due to environment، يعني إنسان دائما عصبي يتعرض إلى دائما مشاكل، شوف ممكن يصير عنده hypertension. مثل ما قلنا physiological activity, diet, occupation and family size. Hypertension and dyslipidemia frequently occur together in association with insulin resistance. Untreated hypertension will short the life by about 10 to 20 years. Remember this point. On the other hand, we have the secondary hypertension, which is represent about 5 to 10%, including of renal causes like renal artery stenosis, polycystic kidney disease, tumor of kidney, acute and chronic glomerulonephritis. The second cause is endocrine disorder, and including of pheochromocytoma, Cushing syndrome, primary hyperaldosteronism, thyroid toxicosis, and hyperparathyroidism. Third, coarctation of aorta and pregnancy. Some medication may lead to hypertension, including of oral contraceptive, steroid therapy, tricyclic antidepressant, non-steroidal anti-inflammatory drug, and cocaine. What are the important clinical features of the hypertension? These including may be at first discovered on routine examination، يعني المريض ممكن يكون ما عنده أي أعراض ويجي للعيادة أو يجي للمستشفى لسبب آخر وتقيس ضغطه تلقى عنده ارتفاع في ضغط الدم. Symptoms may be related to the complications, including of minor symptom, headache, dizziness, fatigue. How to measure the blood pressure? The patient should be seated quietly for at least 5 minutes. The center of the cuff should be at the heart level. The weight of the cuff at least 40% of the arm circumference. Length of the cuff ladder should be in circle at least 80% of the arm circumference. Systole is the first sound that you hear. Diastole is at least or the last sound is the last sound. هنا أنا الحقيقة بعدين إن شاء الله بالعملية راح أشرح لكم الطريقة اللي نقيس بها الضغط. يعني إيش وقت نعتبر هذا السيستول وإيش وقت نعتبره دايستول، وحتى الدايستول راح نشوف بمناطق مختلفة الساوند، نشوف muffling of the sound إيش وقت يصير عندنا، الكاركتوف بوينت إيش وقت يصير عندنا، ولذلك يعني بها شرح مفصل إن شاء الله راح يكون في العملية. What are the important investigations? First of all, chest X-ray, echo. طبعا ممكن نشوف بالأشعة أكو مثلا كارديوميجالي، echocardiogram. Also we will see cardiomegaly or some ischemic heart disease. نحتاج إلى general urine examination, abdominal ultrasound, renal angiograph, serum cortical or cortisol level, and urinary catecholamine. Now, this is the first part of this lecture. The second part of the lecture is the sequelae of hypertension.